My name is Tim Erickson. I'm the Executive Director here at CURE, Children's Hospital of Uganda. I've been working here for 3 years and serving with CURE for 12 now, a total of 12 years in other locations. Personally, I think CURE Uganda is a world leader in treating children with neurological conditions like spina bifida, hydrocephalus, encephalocele. These conditions are very life-threatening oftentimes, and personally, as someone who's trying to make an impact, you want to serve the vulnerable. I do, and my family, my wife and I and our kids felt like God was leading us to want to work in this context to help the children of Uganda, especially the ones with these life-threatening conditions. It talks about in the Bible that Jesus has compassion on the most vulnerable, and I think these are some of the most vulnerable in the world. So CURE Children's Hospital of Uganda is a private, not-for-profit Christian hospital focused on pediatric neurosurgery, along with integrating spiritual ministry into all that we do. That's similar. All of our hospitals are faith-based. The difference here is that the population we serve are children with neurological issues. All the other CURE hospitals, the majority are focused on orthopedics, limb deformities, and orthopedic conditions. And then a few of them are focused on maternal and child health. So Uganda is different, and it's actually East Africa's only neurosurgery-focused hospital of its kind here in this whole region. So it's a world leader. People come here from around the world to get surgery for their children, and then also surgeons coming here to train. Some of the techniques that we do are leading the way, for instance, in how you treat hydrocephalus. The diversity of support CURE gets from regular donations, from charity donations, then from grants and foundations. We also have some small fees patients contribute. So those resources come from either donor organizations that are helping sponsor a patient, or small contributions from the families themselves. How we raise money, we do is every chance we can get, we're promoting CURE, but we have an annual marathon. That's one thing we've been doing. We ask people to contribute directly. We have a Rotary Neurosurgery Week. They sponsor a bunch of surgeries. We have a team in the United States and even some in the UK who are raising money for the hospital. About 65% now of our revenue, our donations, come from outside of Uganda. Then in Uganda, that's the balance. About 35 to 40% is coming from various strategies. We have a guest house. I call the guest house our resident donor. The donation keeps coming. They live up there, that guest house. Every day that someone's in there, we're getting another donation. So that's another strategy. That guest house is a faithful donor. I think the demand for the services is one of our greatest challenges. We're very highly utilized patients filling this place in need of neurosurgery when there's only a few neurosurgeons in all of this region for millions and millions of people. The demand is very high. The other thing, supply costs keep going up. It's very difficult to control, but economically the price of medical supplies and equipment just keeps rising. Staffing costs keep rising too. So how we can work on all those challenges, again, by God's grace, we're trying to contain costs. We try to find donated supplies. We just received an equipment and supplies container from the U.S. that has a high value of items, and it was donated. So that's something. How we handle the volumes. We're trying to train people, more surgeons, to get involved. We're adding another neurosurgeon. Actually, we'll have 3 full-time neurosurgeons along with another senior neurosurgeon who's working with our CURE hydrocephalus program. which is around the world. Patients being treated in other countries, so they don't have to come necessarily to this hospital. So part of our strategy is to train others at hospitals that have the resources, but they need the skill, the additional human skill to know how to treat these conditions, and they come here for training. So we've been doing that for many years now.
Yeah, my name is Jane and I'm with Baby Siobhan. I am grateful to the Lord for Cure, for the great job they are doing, for the fact that they sacrifice and come all the way. It has saved us a lot. We are blessed. The little money that we will be using for going all the way to Mbale, we can use it to help the children. Thank you so much, Cure Uganda. May the Lord bless you and reward you.
I'm Helen, the mother to Jeremiah and Jeremiah, who had made now 10 years. But this sickness started in year 2008 when he was 2 months, advised by the doctor to take him to Mulago Hospital to do ECG, whereby they did and found that he doesn't have epilepsy. So we were taken for a scan. After the scan, they found out that Jeremiah was having a blood clot in the ventricles, both of the ventricles, and later they started him on treatment. From there they said they could not do any further operation. So he was managed from 2 months from Mulago up to 7 years in Mulago. After that, they started renovating Mulago and I shifted to Cure Hospital, whereby they did another scan and other investigation was done. Other things were normal, but the brain still have, the part of the brain was already dead and is living with a half brain as I talk. Since then, Cure was been giving us a total support in treating him. And as you see him here, he's really improved a lot. And I thank Cure for the work well done. Jeremiah is walking, though now he has a part which is not very okay due to the sickness, the brain problem, and the weight he's having made one part not to be okay, but they are trying their level best. Thank you so much. My thanks goes to God, which had really made him to be alive and make him to walk. I knew he could not walk, but God made it possible for him to walk. As well, I give my vote of thanks to Cure Hospital to continue looking forward for the children of Uganda.
Consistently in Cure, year in and year out, the biggest percentage of the hydrocephalus that we treat is post-infectious. It's been documented in up to 60% of the cases, the hydrocephalus is from infections that get to, say, a newborn that migrate to the brain and start to destroy a child's brain. Now, when they destroy the child's brain, they scar or they destroy the path where the water, that's the CSF in the brain, is supposed to be absorbed from. They as well sometimes seal off the natural passages of water. So eventually leading to the hydrocephalus, the too much water in your brain. Now, if we practice safe birth practices, giving birth from hospital, giving birth under people who are trained and who care about your hygiene and try to maintain your hygiene, to go a long way in helping to cut the number of cases of patients with post-infectious hydrocephalus. It's important as well to adequately treat neonatal sepsis, to adequately treat infections that get into a baby's body, because babies' brains are not yet formed well, so they find themselves easily to the brain. So adequate treatment, and this as well goes to the health workers. We've had heartbreaking stories of kids who get PNH. Even when the mothers sometimes are able to recognize the symptoms early and go to hospital, some have been turned away, some have been given syrups. Some have been given treatment for less than the number of days they're supposed to get. And the outcome is child gets hydrocephalus. And this eventually robs them of their childhood, robs them of their adulthood, which I think we could go a long way trying to avert.